Hello, my name is Carla Isabel Ferreira, and I am an anesthesiology resident of Hospital of Braga from Portugal. I'm going to talk about hip arthroscopy in the ambulatory setting, our reality. So, hip arthroscopy is a minimal invasive surgery for diagnosis and treatment of hip pathology. We know from the published studies that it can be associated with severe postoperative pain resulting in a delay of buccal discharge. We conducted a retrospective cross-sectional study of patients which were submitted to hip arthroscopy in our ambulatory unit over the past 6 years. The scope includes the analysis of the clinical records of all patients who were submitted to hip arthroscopy in the ambulatory setting between May of 2014 and May of 2020, and the inclusion criteria were adults between 18 and 70 years old as 1, 2, 3. We exclude patients who didn't meet the inclusion criteria or whose with anesthesia charge was absent. In total, 19 patients were included. Most of our patients were young, with the mean age of 36 years old, predominantly male, 74%, and were healthy or had mild systemic diseases. The majority of our patients were submitted to general anesthesia or general anesthesia plus wound infiltration with 20 millimeters of 0.75% of ropivacaine. The intraoperative mean IV morphine equivalence administered was 245 milligrams. The mean surgery time was 147 minutes, and the mean PACO time includes phase 1 and phase 2 recovery time. The maximum time includes the influence by patients with overnight stays. So our mean PACO time was 460 minutes. 7 of our patients experienced postoperative pain in the PACO. Mean time to request opioid in the PACO was 45 minutes, and the mean IV morphine equivalence administered was 7.5 milligrams. The maximum opioid required was 20 milligrams, and the minimum was 2.5 milligrams. This chart represents the distribution of patients who experienced postoperative pain, time to request opioid, and the mean opioid requires in the PACO by the type of anesthesia. Contrary to our expectations, the time to request opioids is similar in the 3 different groups. Additionally, patients who were submitted to general anesthesia and peripheral nerve block had higher consumption in the PACO. Overall, comparing to date of published studies, our demographic data was similar, but the length of the surgery appears to be longer. The type of anesthesia did not significantly influence the NRS in the PACO, and this post-operative pain was well controlled with IV opioids. Regional anesthesia did not increase the discharge time in the PACO or increase the risk of fall. There were no anesthetic or surgical complications reported. Thank you for your attention. Any question?